Hi, my name is Melissa Magyar. I'm a registered nurse and the owner of Swan Aesthetics in Stillwater. Today I'm going to be performing a Dysport treatment on Gina. And Botox and Dysport are just two very similar products. They're just different brands made by two different manufacturers. They're both just purified proteins that help relax select muscles throughout the face. So they help with creases and wrinkles that are caused by facial movement. And they both last about 3 months on average. However, if you inject the muscles consistently every 3 months for like a year, then what oftentimes will happen is the muscles start to lose that memory. And then you can hopefully wean down and use a little bit less product each time, and it may start lasting for sometimes even 5 months. Some people are more sensitive to the product, so those are the lucky ones, but usually 3 to 4 months is pretty average for longevity. Common areas that you can inject both Botox and Dysport are in the forehead. We see those horizontal lines eventually start to form from lifting the eyebrows up and down repetitively. And so that's a very common area to have injected. Also in between the brows, some people get those really deep frown lines. So that's another area that can be treated with Botox and Dysport. And then here, I usually like to tack the brow down just using 1 or 2 units. Otherwise, if you relax the top part of the forehead but you don't tack the brows down, then the patients continue to lift the lateral part of the brows up and down, and it creates a little comma. So I just like to place just a little bit here to relax that muscle a little bit. And then another area that we can inject, we call them bunny lines. Those are little wrinkles that you get from kind of scrunching up the nose. Not everybody does this, but some people do have a tendency to form creases there, so those can be treated. And then around the eyes, that's another really common area to have injected. We can also do some above the lip for little perioral lip lines. That can help with little superficial creases. However, if the creases are deeper, then you'd want to combine Botox or Dysport with a dermal filler, and that's a little different. That helps restore volume. It's like a gel that you inject into the skin, so that's a really common combination to do for the lip and around the mouth. This area, these are called your DAOs. So when you inject down here, it just lifts the corners of the mouth ever so slightly to just make the mouth corners look a little happier and not turn downward so much. And then on the chin, some people tend to get almost like an orange peel look to their skin from kind of the muscles moving in that area. So we can inject a little bit there just to soften that muscle to make the skin appear a lot smoother. So, and then pre and post care, prior to any kind of injectable, you want to stop using aspirin, ibuprofen, Aleve, Advil, fish oil, Motrin, and alcohol for about 5 days prior, especially if you're going to have the eye area injected, because that skin is just more delicate anyway, and the skin's a little bit thinner, and you don't want to cause excess bleeding, because if you have additional bleeding during the treatment, then you end up with some bruising. So bruising isn't all that common unless you've been taking blood thinners ahead of time. Most people leave here and they just look like they have little tiny mosquito bites in the area, and those usually resolve very quickly. You can go home and put a little cool compress on the area after having Botox or Dysport, and that takes that little bit of swelling down a lot faster. But it's really easy. People come in and out on their lunch breaks and go back to work the same day. There's no need to take any time off of work. It's really an easy treatment. So I'm just going to demonstrate injecting Gina in between her brows today, even though we're going to do multiple areas, but we're just going to do that for now. All right, you ready? Mm-hmm. Just going to turn towards me. Just turn towards me just a little bit. There you go. Perfect. Here we go. A little tiny poke. 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 And poke. All right, go ahead and hold a little pressure there. Good job. So that was it. That's all there is to it. And then post-care, She is not going to want to lay flat on her back for the next 3 hours. You want to be really gentle cleansing in between the brows. We don't want the product to migrate too far beyond where I placed it. And then so no vigorous exercise for 24 hours, no really hot baths, hot tub saunas, anything that'll dilate the blood vessels for 24 hours because that could cause additional bruising. She had very minimal bleeding, so she most likely will not bruise at all in that area. Do you have any questions at all? Pretty simple, right? How would you describe the sensation? Just like a little pinch.
Pull. Yeah.
Yeah, look it. See? It's already done bleeding. Then we'll just wipe away her little dots, put a little arnica gel on, and she's good to go. And the Botox and Dysport will start kicking in usually within 5 to 7 days, but it will take full effect at 2 weeks. So that's when you can determine whether or not you need more, but hopefully we used enough. I'm pretty good at guesstimating the number of units, so we'll check back in 2 weeks and see how she's doing. All right, thank you so much for watching.